Well, we've got to become our own doctors. We've got to relegate medical doctors to serious emergencies where you're run over by a truck or you fall off a roof and you have 4th-degree burns and stuff like that. As far as day-to-day care, the medical system has failed us terribly. I would give the medical doctors an F minus for 1,000 minuses. Recently, of course, the government and the medical associations themselves are telling us that our children will be the first generation of Americans who do not live as long as their parents. That's a terrible failure of the system. We spend more money for health care than all the other nations of the world combined, and that's what we get. Our kids will not live as long as us. And then the number one cause of death in America is proactive medical treatments, which would be considered correct treatments. Okay, 15 million Americans are killed, injured, and infected by medical doctors each year. That's from the Institute of Medicine, the Journal of the American Medical Association, and the Center for Disease Control. 15 million Americans are killed, injured, and infected each year in America. The number 2 cause of death in America is cardiovascular disease. The number 3 cause of death in America, and this just came out a couple of weeks ago, Johns Hopkins School of Medicine got it published in the British Medical Journal because no American medical journal would publish it. The medical doctors, now in addition to being the number 1 leading cause of death in America, but also number 3 as far as mistakes. Medical mistakes are the 3rd leading cause of death in America. Okay, we're talking about 251,000 people are killed just by simple mistakes by doctors. And so I urge you to contact your young GV associate and say, look, I need to get going here with the 90 for Life program. I need the Dead Doctors Don't Lie book, the CD, the DVD. I need the trilogy books, Let's Play Doctor, Let's Be Herbal Doctor, and the Passport Aromatherapy, so I can learn how to be my own doctor. I need to learn how to do our own physicals in our family, because you don't need a doctor to get a diagnosis of diabetes or arthritis. If you squat down and your knees are popping or cracking, you got arthritis. Okay? If your back hurts and you walk bent over forward, you could have a disc problem or arthritis or bone spurs in your back. And, of course, if you're losing some weight, you're urinating 3 or 4 times an hour, you're very, very thirsty, the odds are you might have prediabetes or diabetes. You run to the pharmacy without a prescription, and you get the test strip that a diabetic uses to monitor their blood sugar. And if your blood sugar is 98, you're not a diabetic. But if your blood sugar is 140, you're a diabetic. Okay, you take the 90 cents of nutrients, you throw in the secret sauce for supporting and promoting healthy blood sugar values and and sugar and carbohydrate metabolism at the cellular level. Within a couple of weeks, you test your blood sugar again, and by golly, your blood sugar is like 82 now. Okay, you're an ex-diabetic. You didn't need to go to a doctor to do all that. Same with arthritis. You don't need to go to a doctor to get knee replacements when you have arthritis. Contact your young GV associate and say, hey, I need those books. I need the Dead Doctors Don't Lie book, CD and DVD. I need the trilogy books, Let's Play Doctor, Let's Be Herbal Doctor, and Passport Aromatherapy. I need to learn how to support and promote maintenance repair, cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone, makes your bone itself. Well, my doctor says you can't regrow cartilage. Well, your doctor's a liar, okay? You actually need to educate yourself. Spend a little bit of time, have a family meeting, get everybody going in the same direction. Once or twice a year, do everybody's physicals. Have a book with everybody's name and their weight and their blood pressure. You can do the blood pressure. You don't need to go to a doctor to do your own blood pressure. You can take your own pulse. You can take your own weight. You can take your own blood sugar values. You can do your own urine test. $1.50 for a test strip that does like 8 different things for you. You can do the equivalent of the colonoscopic exam. You don't have to have some intoxicated doctor. 52% of doctors, when they come to work, are intoxicated on alcohol, street drugs, and prescription drugs. You don't need an intoxicated doctor sticking a garden hose up your rump, puncturing your intestine like they did Andy Rooney, from 60 Minutes and killing him. I mean, this happens 15,000 times a month, 180,000 times a year, just from screening tests. So why would you go to a doctor and be at risk at 15,000 a month, 180,000 a year? Doctors kill people on screening tests, okay? And so why don't you do these things yourself? Again, contact your NGV associate. Look, if you become a student of this information and help other people, I will send you a check every month, and your check will help pay for your stuff. Your supplements will be free. A lot of people say to me, Doc, I got parasites. My doctor says they have parasites. Well, the book Let's Play Doctor shows you how to do your own parasite exam. You can see the little one-celled parasites and also the little wormy ones. Tells you what to look for when you're looking for them and how you can actually very accurately diagnose them yourself. Because did the doctor show you the eggs or the segments or the little larvae underneath the microscope? No. He just said I had parasites. Well, what if you have gluten intolerance and you have irritable bowel syndrome and you don't really have parasites? And the doctor didn't know you had gluten intolerance, and so he just made up something to make you feel better. Type 2 diabetes. You don't need to go to a doctor to figure that out and solve it. Osteoarthritis, osteoporosis, infertility. There's one, $25,000 for in vitro fertilization. Okay, well, I've had 3 miscarriages. Well, you're not infertile. You got pregnant 3 times. Your doctor's lying to you. Don't spend $25,000 for in vitro fertilization or artificial insemination. Do it naturally. You have a lot more fun. And guess what? You take the 90 essential nutrients, get on a gluten-free diet, and wait 6 months before you try for pregnancy, and guess what? You won't have a miscarriage. You'll get pregnant and you'll have a beautiful baby. Well, contact your Young TV associate today. Say, I'm in. I need to take care of my own family. I need to know what to do. We'll be back with Dead Doctors Don't Lie for these messages. Okay, Doug, what pearls of wisdom do you have for us?
Well, we've got to do this one every year because it is now the month of July, and they call July the July effect. And that's coming from the medical industry, as the CNN headline story reads, why you should never go to the hospital in July. And this was from a study that was done back in 2011, and it was published by the Journal of General Internal Medicine. And they find that every year in the month of July, the amount of medical mistakes and hospital and deaths increases by 10% during the month of July. And that's due to medical errors, which we now know is the 3rd leading cause of death in this country. So probably in July it may jump up to 1 or 2. And they go on to say typically medical students graduate in June and begin their first residency training in July. The group are eager new interns invade the hospital to learn to care for patients and make medical decisions. One problem, they don't know what they're doing. This was one intern himself who was telling his own story. He said, like most interns, I arrived with 4 years of medical school under my belt, MD after my name, and virtually no practical knowledge of medicine. I kept pockets packed with condensed medical manuals that we called the peripheral brain and make up for the lack of knowledge held in my actual brain. Said on his first night on call, walked into a dimly lit hallway to the call room. Only sound emitting was a beeping of a heart monitor. Suddenly, loud sirens ringing overhead. Nurses rushed out of a room right in front of me. Call a code, as she yells to a secretary, and the nurse looks in my direction and says, "You're a resident, right? I need you to run this code." So he goes, I look left, right, and behind me. He says, "Oh, okay." Truth is, he said, I just finished my orientation, which included a course in advanced cardiac life support, but had not spent 1 minute reviewing the manual. And says they're not feeling confident at all. They rushed into the room, see the cardiac monitor. The patient was in ventricular fibrillation, and he started, which I guess happens right before they die. So they got oxygen on him and starting to do an IV. And they say, "What should we do, doctor?" And he says, "My mind goes blank." Make a long story short, he eventually decided that he needed to do cardioversion, which is the electroshock therapy. And he put the paddles on, and all of a sudden the nurse yelled, "Stop!" because he had the paddles on the liver and would have killed the patient. And so, he goes on to reflect from there. But it just goes to show that, especially in the month of July, you need to stay away from these guys because they're killing people left and right.
Yeah, exactly right. And actually, I think there was a book written back in the 1980s, Doug. It was called Died at Duke. They were talking about that July effect in the 1980s. And just remember, as you pointed out, the 3rd leading cause of death in America is medical mistakes. 251,000 people are killed. And these are the sort of reasons why people get killed is, people who don't know what they're doing are in life-threatening situations, and they do the wrong thing. Or they're doing something very, very routine, and they're intoxicated and not paying attention, and they kill the patient with mistakes. And so, again, I cannot thank you enough for bringing this up, because it's not just me saying these things, Doug. I mean, these are, very well-respected organizations and journals and so forth, and they're tattling on themselves. There was one in the San Diego newspaper this weekend. They said 192 hospitals in California were fined a total of $17 million last year. That comes out to $110,000 each. That wasn't very much for killing 1,200 people. Well, stick with us. We'll be back with Dead Doctors Don't Lie after these messages. Okay, Doug, let's go to callers.
All right, let's head to Florida. And Sandy, you're on with Dr. Wallach.
Oh, Sandy, you're on the air.
Hi, Dr. Wallach.
Hi.
Very nice to talk with you.
Well, thank you.
I'm calling about my mother. She's in a great deal of pain. Let me give you a quick history. She has been diagnosed with diabetes. In 2005, 2008, she had Lyme, and so she did a couple of rounds of antibiotics, but it never really got cleared. Then in 2012, she had AFib, arterial fibrillation, congestive heart failure, and her injection fraction was 30, but now it's back to 50%, and that happened twice. It also happened in 2015. And then she had ear, nose, both nostrils were infected and ears were infected in 2012. In 2013, she was diagnosed with gastritis and esophagitis and irritable stomach and stomach spasm, whatever. And then I'm getting back to my question. And then this year she went to a rheumatologist finally because she's been in pain for these past 8 years, and she has had a high SED rate, and the rheumatologist said she had osteoarthritis in her knee to her spine, and she has tendinitis in her rotator cuff and shoulder.
Okay, I think I get the picture. How much does she weigh?
She was weighing 200. Now she weighs 175.
Okay, and how tall is she?
She's 5'6".
Okay. And did she ever have any respiratory stuff, any asthma, bronchitis, or things like that?
No, but she does have trouble breathing because her nostrils are stuffed.
Yeah, I heard that.
Okay. Let me quickly say she was put on prednisone, right? And she was on that for 95 days, and then the rheumatologist put her on methotrexate, and she had 3 shots of it, and I couldn't handle it. And this is recent. This is in June, and I gave her 3 shots, and the 3rd shot, she was supposed to take 4 shots and then go back and see her. I couldn't do it because she's like loopy, and she like totally fell apart on me.
I get it. Now, here's the deal. When you have 18 different problems like that, there's always one basic underlying problem, and you've given us sort of little suggestions of that, the gastritis, that sort of stuff, kind of upper respiratory things in her sinuses and so forth. This Lyme's disease with the rashes, does she still have some of those rashes from the Lyme's disease?
No, but she had I think she still has she was tested, and she was 4 out of the 10 positive, and so you have to have 5 to be positive for the Lyme. So she still has it in her, but she doesn't have it.
Okay, I got you. So hang on, we'll be back, and we will get your pen and paper ready, because I'm going to do all the talking when we come back. Okay, Doug, let's go right back to Florida and Sandy. Let's see here. Shar, were you on the line when Sandy was giving us her mom's problems?
I was, yes.
Okay, young lady. What's her mom's basic underlying problem?
She's got a gluten intolerance. That's why she keeps coming down with all these diseases.
Absolutely, all of which are nutritional deficiencies. Also, this Lyme's disease, do you believe she's got Lyme's disease?
No.
No, exactly right. No, I would give that doctor who gave her diagnosis of Lyme's disease an F. F minus for 1,000 minuses. He picked that because he didn't know what she's got, and he picked it because insurance will pay for it. You know, there's a slot in the code book, insurance code book for Lyme's disease, so he just pushes the button and insurance pays for it, no questions. And even with the recent test, it said she didn't have it, and they're still saying she has it. No, well, guess what? She never had it. And what about AFib? Is that a heart problem, Shar?
Absolutely not. It's a mechanical problem.
What's happening?
The nerve that controls the heartbeat goes through your backbone, and it's getting squeezed because she's got lost her cartilage between her vertebrae. Yeah, the cartilage and the disc, it's all degenerating, and she may have even shrunk a few inches. Okay? So, here's a lady, she's got sort of generalized pain, which could be called arthritis, it could be called osteoporosis, it could be called fibromyalgia, muscles are involved. She's got diabetes, she's got upper respiratory infections, she's got atrial fibrillation,
She's got skin problems because of the Lyme's disease thing with misdiagnosis. She got gastritis, maybe irritable bowel syndrome. And so, what would you actually suggest this lady take?
Well, first of all, get on a gluten-free diet, obviously. I would give her 2 healthy brain and heart packs, and then I would add the glucogel, and I would add the de-stress, and I would add the Ultimate Daily Classic, too.
Yeah, the de-stress is for the congestive heart failure. Very, very good. You hit that one on the head. What would you give for the diabetes?
Sweeties, of course.
Sweeties, yeah. You give her 3 of those twice a day. And then if she's on medication, she should check her fasting blood sugar every morning before she medicates herself. Because if she gets on this program, this will support healthy blood sugar levels and support healthy sugar and carbohydrate metabolism at cellular levels. So everything changes. And Sandy, your mom can look forward to great benefit here. I would change doctors because from all this, I would say that they're very ignorant. Maybe they just graduated, and this is July, okay? And so, yeah, your mom needs to flee from these doctors because they missed it badly. They're diagnosing all these diseases, but they don't realize that they're caused by a common problem. And the change in diet and supplement program can do great things, including the AFib. Again, you throw in that glucogel, 175 pounds. They give her 15 of those a day, 5 at breakfast, 5 at lunch, 5 at dinner. That's 2 large bottles a month. And that will support and promote maintenance and repair of the cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone makes the bone itself, push the vertebrae apart, take the pressure off the roots of those spinal nerves, and AFib tends to go away. Doctors don't mind billing you for $500,000 for cardiovascular procedures, but it's a back problem. We'll be back with Dead Doctors Don't Lie after these messages. Okay, Doug, let's go to callers.
All right, let's head to Pacifica, California. And James, you're on with Dr. Wallach.
Well, James, you're on the air.
Hi, Dr. Wallach. Thanks for taking my call.
Yes, sir.
First of all, let me say that we love you. You're wonderful, and we pray for you every day.
Appreciate that. Thank you so much.
I have 2 things I want to talk about. I want to give you some feedback because I called about 3 months ago, and then I want to tell you about another problem I'm having.
Mm-hmm.
Okay, so here's the feedback. I called up about 3 months ago because I was having problems with falling asleep after a meal. Well, that is now stopped. That's completely gone. And in addition to that, I lost 35 pounds since I last spoke to you.
Now, isn't that amazing?
And I'm feeling great. Yeah, it's amazing. And I haven't done any exercise at all.
Well, exercise can be a negative. Yeah, exercise can be a negative when you want to lose weight. In fact, Loyola University in Chicago in January of 2009 came up with a 10-year study that said exercise alone won't make you lose weight. You have to get on a 500 a day calorie diet to use exercise as a weight loss program. And when you get back up to 1,000 calories a day, because you can't keep going on 500 calories forever, you'll gain all the weight back. And so exercise is the last thing you want to do if you really want to seriously lose weight and keep it off.
Yeah, that makes sense. So, and I am slowly getting my sleep cycle back to normal. Whereas before I was getting up at like 11:30, 12 o'clock at noon. Now I'm getting up at 8 o'clock. So it's slowly moving back to where it should be. But also, I have another problem that I've had for the last couple of years. I have some kind of internal hernia where the entire left side of my groin is like bulges out every now and then, and I could push it back in. It feels like my intestines are going down into my lower abdominal area.
Sure. Okay, well, how much do you weigh?
I weigh 195.
Okay, and how tall are you, sir?
I'm 5'9.5".
Okay. Now, Charmaine, this is a Char thing. You know about this personally, don't you?
Yes.
What would you do? What would you suggest for James to deal with a inguinal hernia?
He needs to put a block of wood under the bottom legs of his bed, so the bed is...
Feet of the bed. Mm-hmm.
Feet of the bed, so it's going up a little bit. And then he needs to get a truss. My husband got a hernia, and believe it or not, he went to a surgeon last Friday morning, and he talked him out of having surgery because he said he only wears the truss when he works outdoors. but when he's inside, walking around and just doing things here and watching TV, he does not wear it. And he said, well, there's always could be trouble with surgery, complications, and it's better if it's not broke. He said, don't fix it. And he does a lot of surgeries. He said he had done 4 that week, and he was doing another one that Friday during the day. So it wasn't like he wasn't experienced in doing it, but he talked him out of having the surgery. He said, as long as you can push it back in, it's soft. Don't worry about it. If it gets hard and you can't push it back in, you'll probably also feel like throwing up. That's your bowel sticking through, and then you need to get help. But unless that happens, don't worry about it.
Yeah, and of course, the secret is here. You did exactly as we said. You put a 2x4 underneath the feet of the bed, so you guys are sleeping with your head an inch or two below the level of your feet. And that way gravity is working to pull all the intestines out of his pelvic area, which puts pressure in the inguinal area for when you have the hernia, and pulls it back up into the upper belly cavity. And that alone allows the inflammation to go away and healing to take place. And a 1-inch hole might become a 1/4 of an inch hole. Okay, and as long as you're taking the 90 essential nutrients, it wouldn't hurt to throw in some extra glucogel, support and promote maintenance repair of cartilage, ligaments. Here we go, ligaments, tendons, connective tissue, which is what's been stretched or damaged or torn. That's the tendons and ligaments and connective tissue. And so when you let gravity help you by putting that 2x4 under the feet of the bed, so when you're sleeping for 6 to 8 hours, the gravity of the earth is helping you with a free treatment there. And so exactly right. Don't forget, keep doing what you're doing because obviously you're getting benefit. And so just keep going with what you're doing. But I would definitely put the 2x4 under the feet of the bed, get a truss, as Shar says, and if you're up vertical, walking around doing things, unloading cars or mowing the lawn, that sort of stuff, wear the truss. And call us back in another month or so. Let us know how you're doing. Okay, Doug, let's go to callers.
All right, let's head to Newfoundland, Canada. And Clarence, you're on with Dr. Wallach.
Well, Clarence, you're on the air.
Hi, Dr. Wallach. How are you today?
Okay, sir. How can we help you?
I'm calling on behalf of my sister-in-law and her husband. They got some health issues. They're 50 years old. The husband is 5'10", weighs 250 pounds. He's a type 2 diabetic, and he's got high blood pressure, but he refuses to take any medication. So we want to go the natural route.
Okay, so he's got type 2 diabetes. High blood pressure, you say he's 200 pounds?
250.
Oh, 250. Okay. Anything else we need to know about?
No, that's it for him.
Okay, Shar, this is a Shar thing. What would you do for type 2 diabetes and high blood pressure and a 250-pound guy?
Well, ideally he should take 3 healthy blood sugar packs, and then he needs to add the cardio or Ultimate Daily Classic to that, and the cardio sticks and the what do you call
niacin?
it? Niacin Plus.
Yeah. Okay. Yeah. Ideally, as Shar says, Clarence, this guy, is he your brother?
My brother-in-law.
Oh, your brother-in-law. Okay. And so, he needs, because 250 pounds, ideally he would take, I'd be real heavy duty with him, no pun intended here. I'd go with 3 of the healthy blood sugar packs per month, a full dose of everything 3 times a day, full dose of everything, including the sweeties at breakfast, lunch, and dinner. For the high blood pressure, I would throw in the Ultimate Daily Classic tablets, 12 of those a day, 4 breakfast, 4 lunch, 4 dinner, be 3 bottles a month. I'd throw in 3 of the Ultimate Cardio Sticks. That's 3 boxes a month. They come 30 in a box, 1 at breakfast, lunch, and dinner. And I go ahead with 6 of the Ultimate Niacin Plus a day. I go with 2 at breakfast, 2 at lunch, 2 at dinner. That'll be 3 bottles a month of the Ultimate Niacin Plus. And this is going to support and promote healthy blood pressure, support and promote healthy blood sugar. And again, he needs to take his fasting blood sugar before he medicates himself every morning. And if finances are a problem here, then he could cut it back to 2 of everything a month. And of course, 2 doses a day, breakfast and dinner instead of 3. But ideally, once you get it done fast, he needs to go with 3. Now, hang on. We'll talk about your sister-in-law when we get back. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Youngevity, United for Life Crusade. And Doug, let's go right back to Newfoundland, Canada, and Clarence, sister-in-law. Basically, she has a degenerative disc disease. We asked him this question over the break. She has degenerative disc disease, back problems, of course, 186 pounds, 5'5". 5'5", I'd like to see her, a woman, weigh 145, so she needs to lose about 30 pounds. So what I would do, Clarence, to start out, I would give her 2 healthy brain and heart packs per month. 2 healthy brain and heart packs per month. Give her everything, a full dose twice a day. Get 2 large bottles of glucogel, so she can have 15 of those a day, 5 at breakfast, 5 at lunch, 5 at dinner. And if she has pain, she can get the CM cream and trauma oil and put that on her lumbar area of her back or in between her shoulders, wherever she has the pain and the degenerative disc disease. And obviously, the trauma oil and the CM cream will give her results and as far as pain relief and reduce inflammation within 10, 15 minutes for, say, 3 to 5 hours. It takes about 60, 90 days to see something dramatic as far as supporting and promoting maintenance repair of the disc. But they will repair. And give it time. Stay away from all the bad stuff, no fried foods and processed meats, and oils or gluten. Okay, Doug, we have time to start another one.
Yeah, let's head to Knoxville, Tennessee. And Caleb, you're on with Dr. Wallach.
Oh, Caleb, you're on the air.
Hi, thanks for taking my call.
Yes, sir. What's up?
I'm calling back for an update. I spoke to you back in March about my friend, and she was having nightmares and sleepwalking every night, and it started around Christmas time, so it's been about 6 months now. And since we spoke to you, we've been taking the Healthy Body Pack and the Sleepies. Now, last month, I happened to pick her up a bottle of potassium from the dollar store, and that completely, along with the Healthy Body Pack, that completely wiped out her nightmares, but it didn't do anything for sleepwalking. The reason I got the potassium was because she was also having muscle cramps. Now, ever since we started the Healthy Body Pack, we've kind of had better results and better, it's kind of made it better. But
so what does she weigh?
95 pounds.
Okay. And how tall is she?
5'8".
Oh, she is tall and skinny.
Yeah.
You say she weighs 95 pounds or 195 pounds?
95.
Okay, yeah, she's tall and skinny then.
Yes.
And does she have any other issues, any skin problems, any asthma, bronchitis? Does she have kids with any of those problems?
Well, no, she had diarrhea, but we got on the gluten-free diet, like you said, and that completely went away.
Okay, good. All right. And she may still have some residual gluten, so she got to double check and make sure nobody in the house, spouse, dog, cat, mom, mother-in-law, renter, partners, everybody in the household is going to be drop-dead gluten-free. And let's see here. What would you do, Shar, for somebody who is doing the sleepwalking thing?
Well, I don't know. I guess.
What would you do to make the brain happy?
I give them Synaptive.
Yeah, very good. You get an A+. Okay, Synaptive. I'd throw in 2 of those twice a day. It'll be, I think you can get away with 1 bottle a month for that. And then also, I want her to have the de-stress capsules, have 3 of those twice a day, 2 bottles a month. And again, stay away from the bad stuff and keep her away from caffeine after 12 o'clock noon from any source, whether it's tea or coffee or soft drinks or whatever. And that'll help. And just keep her going on the Sleepies and keep her going on the 90. But I would kind of upgrade. I go for the Healthy Brain and Heart Pack, 1 of those, and then divide everything in half instead of just the Healthy Start Pack. I go for the Healthy Brain and Heart Pack, cut it in half a dose of breakfast, half a dose of dinner. And the fact that she got a good response on gluten-free, really crank down and make sure she's really gluten-free and everybody in the household is really gluten-free. And then call us every couple of weeks and let us know what's going on. Okay, well, thank you, everybody. Great testimonies today and lots of great information and questions. Thank you so much, Shar. Super job as usual. Thank you so much, Doug and Richard. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.
Hi everyone, Andy Anderson here. Are you using those handy little bottles of gel that zap germs, bacteria, and other nasties? In today's world, that's smart, especially with all the filthy doorknobs, shopping carts, and handrails we touch every day. Here's what you may not know. Once the alcohol evaporates, goodbye effectiveness. No more protection until you use it again. PureWorks to the rescue. Our FDA-compliant foam, lotion, soap, and spray do not rely on alcohol. Their killing power lasts up to 4 hours. PureWorks disinfecting spray is EPA certified to kill swine flu, bird flu, MRSA, HIV, hepatitis B and C, and a whole host of viruses and bacteria. Mold and fungus too. It's even safe around children and pets. You'll love the soft feel of PureWorks on your hand. It actually conditions and will not dry your skin. Here's a little peace of mind knowing your hands are still germ-free hours later. Get your hands on PureWorks and get PureWorks on your hands. Stand by. Pull out your paper and pencil for your local number to order PureWorks.
Good liver health is vital to your overall health. Did you know the liver is the largest gland in the body? Generating digestive enzymes, converting fat into fuel, controlling metabolism, regulating cholesterol in the blood, and neutralizing toxins and waste products. Decreased liver function can lead to debilitating diseases. Hepal, a proprietary blend exclusive to Prohoba International, can help support healthy liver function. Hepal is a blend of natural organic pollen extracts, including essential enzymes, botanical glutathione, which is considered to be one of the most powerful antioxidants for detoxifying free radicals and exogenous compounds, superoxide dismutase, and aloe vera, formulated to cleanse and support healthy liver function. If you'd like to have healthy liver function, call your local longevity distributor today, and don't forget to ask about home-based business opportunities.
If you've been diagnosed with type 2 diabetes, prediabetes, or the metabolic syndrome, and you're tired of seeing your blood glucose levels rise and fall like a ship on the ocean, but you don't want to take those drugs the rest of your life, Longevity has an alternative. A product called Sweeties has been developed just for you. Used as part of your regular diet, Sweeties helps maintain healthy blood sugar levels. A formulation specially designed to nutritionally assist your body with the regulation of your blood sugar level. Sweeties supports healthy glucose metabolism because it's fortified with aspartic acid, chromium, and vanadium, all to help you promote healthy blood sugar levels. If you want to get off those drugs and control your blood sugar metabolism naturally, try Longevity's Sweeties product. If you'd like to learn more about nutritional supplementation, call your local Longevity associate, and don't forget to ask about home-based business opportunities.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Longevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Longevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Longevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Longevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463. 3463.
I am Judy DeVilbus. Here I am speaking to you again. I just wanted to tell you that recently I started drinking the Whey Shakes again, the chocolate Whey Shake. And you need to remember, the Whey Shake isn't just for losing weight. It's a fantastic place to get your great protein. And if you're trying to gain weight, you can take it along with your meals. And the best part is, if you want to just have a great protein shake, do like I do. Put it over ice, stir it up, and you can sip on it for 20 minutes to an hour. I do it every single day. I absolutely love it. You need to get back to it too. It's really good for you. And it makes not fat, but it makes muscle after you work out. And you can also mix it up in a blender with an egg, and you have the most incredible health protein shake. Or mix it with a little water, stir it up, and you have a little pudding. And who doesn't like pudding?
For more information or to order, call your Youngevity distributor today. And don't forget to ask about Youngevity home-based business opportunities. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
Hi, this is Dr. Joel Wallach, your host of Dead Doctors Don't Lie. If you're interested in a colon cleanse, blood cleanse, liver cleanse, in the classical herbal way, you want to ask your Youngevity associate for Herbal Rainforest. Herbal Rainforest has 16 herbs, 16 cleansing herbs, classic cleansing herbs, and 77 plant minerals. That's right, and these are all organic. It doesn't get any better than that. In your busy day, and you're around all these toxins out there, in your workplace, on the way home, going to work, in your food, in the air, in the water, you need Herbal Rainforest. I guarantee you, it will give you a cleanse. You can control the dose. It's a liquid. It tastes good. It doesn't get any better than this. A colon that's happy makes you happy. Nothing better than a happy colon. Herbal Rainforest. Clean it out.
For more information on this product or others you've heard about on the Dead Doctors Don't Lie radio program, call your local Youngevity associate today. And don't forget to ask about home-based business opportunities.
Greetings, everyone. Judy DeVilbus here. What do you think of when you hear the words tangy tangerine? Well, I think of like a sweet, tangy tasting something. Well, what I'm referring to is the Ultimate Tangy Tangerine. It's a fantastic product. It has everything you need, and a great benefit is it's very, very delicious. It's very easy to drink. I've suggested it even to youngsters. Even children like it. Even little guys. Even little girls. They come right into my office. Their parents can't get them to take those chewables, and besides that, they're not as good as Tangy Tangerine. And I give them a little taste of that, and you know something? They're pleased as punch. So, if it's good for a child and it tastes delicious, why not you? There's no excuse not to take a vitamin when it tastes as good as that does. So how about it? Tangy Tangerine should be the answer to all of your nutritional program problems.
For more information or to order, call your Youngevity distributor today. And don't forget to ask about Youngevity home-based business opportunities.
Hi everyone, Andy Anderson here. Are you using those handy little bottles of gel that zap germs, bacteria, and other nasties? In today's world, that's smart, especially with all the filthy doorknobs, shopping carts, and handrails we touch every day. Here's what you may not know. Once the alcohol evaporates, goodbye effectiveness. No more protection until you use it again. PureWorks to the rescue. Our FDA-compliant foam, lotion, soap, and spray do not rely on alcohol. Their killing power lasts up to 4 hours. PureWorks disinfecting spray is EPA certified to kill swine flu, bird flu, MRSA, HIV, hepatitis B and C, and a whole host of viruses and bacteria. Mold and fungus too. It's even safe around children and pets. You'll love the soft feel of PureWorks on your hand. It actually conditions and will not dry your skin. Here's a little peace of mind knowing your hands are still germ-free hours later. Get your hands on PureWorks and get PureWorks on your hands. Stand by. Pull out your paper and pencil for your local number to order. PureWorks.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
Hi, this is Dr. Joel Wallach, your host of Dead Doctors Don't Lie. If you're interested in a colon cleanse, blood cleanse, liver cleanse, in the classical herbal way, you want to ask your Youngevity associate for Herbal Rainforest. Herbal Rainforest has 16 herbs, 16 cleansing herbs, classic cleansing herbs, and 77 plant minerals. That's right, and these are all organic. It doesn't get any better than that. In your busy day, and you're around all these toxins out there in your workplace, on the way home, going to work, in your food, in the air, in the water, you need Herbal Rainforest. I guarantee you, it will give you a cleanse. You can control the dose. It's a liquid. It tastes good. It doesn't get any better than this. A colon that's happy makes you happy. Nothing better than a happy colon. Herbal Rainforest. Clean it out.
For more information on this product or others you've heard about on the Dead Doctors Don't Lie radio program, call your local Youngevity associate today. And don't forget to ask about home-based business opportunities.
Greetings, everyone. Judy DeVilbus here. What do you think of when you hear the words tangy tangerine? Well, I think of like a sweet, tangy tasting something. Well, what I'm referring to is the Ultimate Tangy Tangerine. It's a fantastic product. It has everything you need, and a great benefit is it's very, very delicious. It's very easy to drink. I've suggested it even to youngsters. Even children like it. Even little guys. Even little girls. They come right into my office. Their parents can't get them to take those chewable, and besides that, they're not as good as Tangy Tangerine. And I give them a little taste of that, and you know something? They're pleased as punch. So, if it's good for a child and it tastes delicious, why not you? There's no excuse not to take a vitamin when it tastes as good as that does. So how about it? Tangy Tangerine should be the answer to all of your nutritional program problems.
For more information or to order, call your Youngevity distributor today. And don't forget to ask about Youngevity home-based business opportunities.